How have you been feeling?
Pretty good.
For a patient with no obvious neurologic problems, perform a screening of her mental status or cognitive function.
Let's go.
Begin by assessing physical appearance and behavior during the health history. The patient should have good hygiene and be well-groomed and appropriately dressed. Also observe the patient's body language. She should have erect posture and make eye contact, and her facial expression and movements should correspond to the situation. Next, evaluate the patient's cognitive abilities, starting with her state of consciousness.
Would that be all right?
Sure, that'd be fine.
Okay. What's today's date?
Today is Tuesday, December 7th.
Good. And your full complete name?
The patient should be oriented to time, place, and person, and be able to respond appropriately to questions and the environment.
My next questions show how you make comparisons.
Also ask her to describe analogies, moving from simple to complex
Musical
ones.
instruments.
Good. Now try and complete this sentence. A cat is to a kitten as a dog is to what?
A patient with average intelligence should be able to respond
What's the difference
correctly.
between a rowboat and a cruise ship?
Well, there are
To
several
continue,
differences. The
test
rowboat is quite
abstract
small,
reasoning.
And a cruise ship is very large. The rowboat has no engine. A cruise ship does.
Very good. Now, tell me what this proverb means. A bird in the hand is worth two in the bush.
If you have something good, don't
The
throw that
patient
away
should be
because
able
it's
to
bad.
interpret the
Because you
phrase
have to get
adequately.
that.
Good.
Next,
Now,
have the
I'd
patient
like
do
you to
simple
simple
arithmetic
math for me.
to assess cognition and attention span.
I'd like you to subtract 7 until you reach the number 8.
Okay. 50, 43, 36, 29.
She should complete the
22,
calculations with few errors within 1 minute.
That sounds right to me.
Also test the patient's ability to write her name and address, or a dictated phrase, which she should do with no errors or omissions. Or ask an older adult to draw a clock face. Two or more errors in the drawing suggest cognitive impairment.
Good. Could you
Next,
please repeat
assess
the series
memory,
of numbers?
beginning with immediate recall.
7, 16, 1, 4, 13, 11, and 6.
7,
The patient
16,
should be able to
1,
repeat 5 to 8 numbers
13,
forward
11,
or 4 to
Very
6
good.
numbers backward. Then test recent memory.
Now I'd like you to look at these 5 items and remember them. I'll ask you to recall them for me later.
Okay.
After 10 minutes, the patient should recall all the objects. Also check remote
Are you
memory
ready to go
by
on?
asking about verifiable
Just
past
bring care to
events.
these. And can you tell me your mother's maiden name?
Her maiden name was Jackson.
Okay.
The patient should answer your questions correctly.
Sure. Parkwood High School.
Move on to determine the patient's
to ask you some
judgment,
questions.
for example,
Show me
with
your
hypothetical situations.
Tell me, what would you do if you found a stamped envelope lying in the street?
I would pick it up and drop it in the nearest mailbox, or I would take it directly.
The patient should provide reasonable responses. To continue, assess emotional stability
pretty good.
by observing the patient's mood and feelings through her verbal and nonverbal behaviors.
Of moodiness or other
The patient should express feelings that are appropriate for the situation.
But usually I come home, take a brisk walk, or play with my grandchildren, and things.
As you talk, note the patient's thought patterns and content. Her thoughts should be easy to follow, with no perceptual distortions. Her ideas should be logical and goal-directed, and her behavior should reflect the emotional content of your discussion.
Doctor's office, more information about the diabetes.
Finally, listen closely to the patient's speech and language skills. Her voice should have inflection and be clear and strong with a range of volume. Her speech should be fluent and articulate. She should be able to follow simple instructions and express her thoughts clearly.
To help my daughter and the baby to stay as healthy as possible.
In a child, speech and language should be age-appropriate, and speech should become more understandable as the child grows older.
Drinks?
Also, complete your test of the patient's recent memory.
Change, let me ask. Do you remember those 5 items that I asked you to remember?
I think I can.
Okay.
There was a blue pen. There was a cotton swab. There was a quarter, a paper clip, and a gold key.
That's correct. Very good. All right. Now
Now examine the cranial nerves by testing their motor and sensory functions as appropriate.
Okay.
Although smell and taste usually aren't tested unless a problem is suspected.
Smell, is that okay?
That's fine.
Okay.
Begin by evaluating the olfactory nerve, or cranial nerve 1.
Now I need to press one nostril closed. Can you still breathe?
Yes.
Okay. What I'd like you to do is close your eyes
Okay.
and tell me what you smell.
Smells like rubbing alcohol.
That's correct. Now I'd like to check the other side.
The patient should perceive the odor on each side and identify it correctly most of the time.
That smells like coffee.
Next, assess the optic nerve, or cranial nerve 2. To do this, test distance vision with a Snellen chart and near vision with a Rosenbaum chart, as in the eyes video in this series. The patient should have 20/20 vision.
And read the smallest line possible from left to right.
63925.
That's correct.
Also test the visual fields by confrontation. The patient's peripheral vision should be comparable to yours.
Say now, when you see my wiggling fingers, move into your line of view.
Now. Now. Now.
Now test the oculomotor, trochlear, and abducens nerves, or cranial nerves 3, 4, and 6 together. As in the eyes video, assess these nerves by inspecting the eyelids, which should have no drooping, and by checking the pupils, which should be equally round and reactive to light and accommodation.
Thank you. I'd like you to look straight ahead and follow my moving finger with your eyes, and don't move your head.
Okay.
Also evaluate the extraocular muscles by having the patient watch your finger move through the 6 cardinal positions of gaze. Eye movements should be well coordinated and full, with no jerking or drifting. Next, assess the trigeminal nerve, or cranial nerve 5. To do this, inspect the facial muscles, and then have the patient clench her teeth while you palpate her jaw. Facial expression tone should be symmetric, with no atrophy, tremors, or fasciculations.
And relax.
For a young child, watch for bilateral jaw strength as she eats a cracker. To assess any cranial nerve in a child, modify your technique as needed, for example by playing a game.
Good.
I need to check the sensation of your face. May I have your hand, please?
Yes.
I'm going to touch your...
After demonstrating sharp and dull sensations with a paper clip or broken tongue blade, have the patient close her eyes. Then touch each side of her face on the forehead, cheeks, and chin, randomly testing sharp and dull sensations, which the patient should identify correctly.
Sharp. Sharp.
Thank you. Now I'm going to check the light sensation on your face. When you feel the cotton wisp, please say now.
Also, randomly stroke the same areas with a brush or cotton wisp, and have the patient say when the stimulus is felt.
Now.
She should feel this light touch in all areas.
Now.
Thank you.
Then check the corneal reflex. With the patient looking up and away, lightly touch one cornea with a cotton wisp. Then touch the other. Both eyes should blink symmetrically, though patients who wear contact lenses may have a diminished or absent reflex.
And look up and to the right. Thank you.
Next, assess the facial nerve, or cranial nerve 7, along with the glossopharyngeal nerve, or cranial nerve 9. Observe the patient as she makes specific facial
I'm going to
movements.
ask you to make several movements, okay?
All right.
Can you raise your eyebrows and wrinkle your forehead? Good. And smile, but don't show your teeth. And puff out your cheeks. Good. And purse your lips like you're going to whistle. And show me your teeth.
All movements should be symmetric,
close your eyes
with
tightly.
no tics or drooping.
You can relax.
To assess
Now I need
taste,
to do a
use
taste
4
test.
flavored
I'm
solutions.
going to put a drop of solution on your tongue, and I'd like you to tell me what it tastes like.
Okay.
Can you stick out your tongue and hold it there, please?
Apply a solution to the side of the tongue and wait for the patient's
Can you tell me what
response.
that is?
Sour.
Good.
Then offer a sip of water and test another solution. The patient should properly identify each taste.
Okay, we're going to try one more time. Please stick your tongue out and hold it.
To continue, evaluate the acoustic nerve, or cranial nerve 8.
Now
As
I'd like to
detailed
check
in
your
the
hearing.
ears, nose,
Can
and
you put
throat
your
video
finger
in this
your right ear
series,
and wiggle it?
perform the whispered voice
Repeat
test.
what I whisper, please.
In each ear, the patient should hear the words you whisper from 1 to 2 feet away.
Purple. Ball game.
That's correct. Now I'd like to check your other
Next,
ear.
do the
Now
Weber
I'd like to place this
test,
tuning fork
in which the
inside
patient
your
should
head.
hear the vibrating
Tell me
tuning
if you
fork
hear it
equally in
both
both ears
or
with
better
no
than
lateralization.
Equally in both.
Thank you.
Also perform the RIN
Now
test,
I'm going to place
in
this
which the
behind your
patient
ear.
should hear the
Please tell me
vibrating
when it
tuning
stops.
fork by bone conduction about half as long as by air conduction.
It stopped.
Can you still hear it?
Yes.
Please tell me when it stops.
It stopped.
Thank you. Now we'll check your other ear.
An older adult is likely to have conductive or sensory neural hearing loss, which can alter the results of the Weber or RIN tests. Now check the glossopharyngeal nerve further, along with the vagus nerve or cranial nerve 10.
Now I need to check the back ear throat.
To
Can
test
you
these
open wide,
nerves,
please, and say,
inspect
"Ah"?
the soft palate. The soft palate should rise symmetrically, and the uvula should be midline. Next, assess the gag reflex. When you touch the posterior wall of the pharynx, the patient should gag, and the uvula should stay midline. Then have the patient drink some water
Now take
while
a
you
few
observe
sips
her
of water.
ability to swallow.
And swallow. And again.
The patient should swallow easily, with no water passing back through the nose. Also consider the patient's
Great.
speech.
How did that feel?
I had no problem swallowing.
You should hear no hoarseness,
No, thank you. That's
nasality,
quite enough.
or difficulty with guttural sound. Now test the spinal accessory nerve, or cranial nerve 11. To do this,
need to check your
evaluate
abdomen
the
next.
size, shape, and strength of the trapezius and sternocleidomastoid muscles.
Is that okay?
Yes.
And shrug your shoulders up. And don't let me push them down.
Okay.
The shoulders should rise symmetrically.
Good. And relax. Now turn your chin to the left and press against my hand.
In both directions,
And now
muscle
turn your
strength
chin to
should
the
be
right
symmetric and full.
And press against my hand.
Finally, test the hypoglossal nerve, or cranial nerve 12, which is usually tested with cranial nerves 9 and 10.
I need to look at your tongue, please, when it's relaxed and when it's moving. Could you open your mouth and stick out your tongue?
The tongue should be symmetric, with no fasciculations, atrophy, or deviation to either side.
And move your tongue from side to side. And curl it up like you're trying to touch your nose. And try and touch your chin. Very good, you can relax. Last of all, I need you to press your tongue against your right cheek,
The patient's tongue should have full muscle strength on both sides.
and now your left cheek. And relax.
That seemed like a pretty thorough exam I've had here today.
Again, listen to the patient's speech. She should have no difficulty pronouncing lingual sounds, such as L, T, D, and N. Even though the neurologic system is highly complex, with the right questions and examination techniques, you can assess your patient's mental status and cranial nerves with ease. And when you consider these findings with those from your examination of the reflexes and motor and sensory systems, you'll be able to judge your patient's neurologic status fully and accurately. Now turn your attention to reflexes.
I'm going to test your abdominal reflexes now. Just
With
try
the
and relax.
patient supine, test his superficial reflexes. Stroke each quadrant away from the umbilicus. With each stroke, you should see slight movement of the umbilicus toward the stimulus. Movements should be equal bilaterally.
I'm going to touch your inner thigh with this to test your involuntary reflexes. Just
As
relax
in the
your
male
muscles.
genitalia
That's right.
exam, elicit the cremasteric reflex by stroking down the inner thigh. The testicle and scrotum should rise on the stroked side. Also elicit the plantar reflex.
Now I'm going to
To
check
do
the
this,
reflexes in
stroke
your
the
feet.
sole of each foot from the heel up the lateral side and across the ball to the medial side. This should cause plantar flexion of the toes with no
Now I'm
fanning.
going to tap on some of your tendons and test the rest of your reflexes.
Okay.
I'll help you sit up.
Finally, evaluate deep tendon reflexes with the patient seated or supine. Because eliciting these reflexes can be challenging, follow these tips. Have the patient relax and focus on other muscle contractions, such as pulling his clenched hands apart. Put slight tension on the tendon to be tapped. Palpate the tendon to locate the right spot to tap. Hold the reflex hammer loosely. Tap the tendon briskly, and compare sides, which should have symmetric responses. Also, score each deep tendon reflex with a 0 for no response, 1+ for a sluggish or diminished response, 2+ for an active or expected response, 3+ for a brisker than expected or slightly hyperactive response, or 4+ for a brisk hyperactive response with intermittent clonus.
I'm going
To
to test
assess
the
the
reflex of your
biceps
elbow
reflex,
first.
bend the patient's arm to 45 degrees at the elbow. Place your fingers under the elbow and your thumb over the tendon. Strike your thumb with the reflex hammer. You should see or feel elbow flexion.
Now I'm going to test the reflexes in your forearm.
Okay.
For the brachioradial reflex, bend the patient's arm to 45 degrees and rest his forearm on yours with his hand slightly pronated. Strike the brachioradial tendon directly. Forearm pronation and elbow flexion should occur.
Now I'm going to test the reflexes at the back of your elbow.
Okay.
To elicit the triceps reflex, hold the patient's arm with the elbow flexed to 90 degrees. Just above the elbow, strike the triceps tendon. There should be visible or palpable elbow extension.
While I check your knee
With the
reflexes,
patient's
I'd like
knees
you to
flexed
clench
to
your
90
hands and
degrees,
try and pull
test the
them apart.
patellar reflex. Support the upper leg with your hand so that the lower leg hangs loosely. Just below the patella, strike the patellar tendon. Watch for lower leg extension.
Keep trying to pull your
With the
hands
patient's
apart
knee
while I
flexed
check
to
your
90
ankle
degrees,
reflexes.
assess the Achilles reflex. Hold his heel so that the ankle is in a neutral position. At the level of the malleoli, strike the Achilles tendon. The foot should plantar flex in response.
Okay, if you could just relax.
Because of age-related changes in deep tendon reflexes, expect an older adult to have diminished responses, especially in the legs.
There's one more test I have to do on your feet and ankles.
Okay.
Last of all, test for ankle clonus. With one hand, hold the patient's leg with the knee flexed and in a relaxed position. With the other hand, sharply dorsiflex the foot once or twice and hold it there. You should not feel any rhythmic oscillations between dorsiflexion and plantar flexion. Assessment of motor and sensory functions and reflexes is only part of the neurologic examination, yet it can tell you a lot about the patient's nervous system. Together with findings from the mental status and cranial nerve examination, and the patient's health history and laboratory test data, these findings can give you a complete overview of the patient's neurologic health.
Okay, Mr. Gardner. Now have a seat on the table.
Next, begin testing sensory function in the hands, lower
I'll
arms,
help you lower your
feet,
gown to your
lower
legs
legs,
so that we
and
can test
abdomen.
your sensory function.
When testing sensory function, expect to find minimal differences bilaterally, accurate interpretation of sensations such as hot or cold, correct discrimination of the side of the body tested, and accurate location of sensations. To test primary sensory functions, begin by assessing superficial touch.
I'm going to need you to close your eyes. I'll demonstrate each test before I do it. I'm going to touch your skin with a cotton wisp, like this. I'll need you to point to each place where you were touched.
Okay.
Go ahead and close your eyes.
Be sure to use a light touch and avoid stroking areas with hair. Because this test also assesses point location, note whether the patient has any difficulty localizing the stimulus, which should not be a problem. Next, assess superficial pain.
Okay, Mr. Gardner. I'm going to touch you with this broken tongue blade. I'm going to need you to tell me whether it feels sharp like this or dull like this. And point to the place where you were touched. Go ahead and close your eyes.
Sharp.
Apply the sharp and dull stimuli randomly, allowing 2 seconds between stimuli to avoid a summative effect. Wherever you use a dull touch, also use a sharp touch, because the dull stimulus is the control.
Dull.
This is hot, and this is cold. Let me know which one you feel and where you feel it.
If superficial pain
Go ahead and close
sensation
your
is
eyes.
impaired, assess temperature and deep pressure sensations.
Hot.
For temperature, roll test tubes of hot and cold water against the patient's skin and have him identify the temperature and location.
Hot.
Tell me what this feels like.
To evaluate deep pressure, squeeze the patient's trapezius, biceps, or
Now?
calf muscle.
The same.
This should cause discomfort.
Now,
Also the same.
I'm going to touch you with
Continue
this
by
vibrating
testing
finger in
vibration.
a few bony areas. Please tell me when and where you feel it.
Okay.
Go ahead and close your eyes.
Begin testing at the most distal joints and move to
Now,
proximal
left toe.
ones. Occasionally dampen the tines
Now,
to
my
see if
left
the
ankle.
patient notices the difference.
Now, my right knee, but it doesn't feel the same. It's not vibrating.
Next, check joint position sensation.
Now I'm going to raise your toe up like this or down like this. I'd like you to tell me whether it's up or down.
Okay.
Go ahead and close your eyes.
Remember to hold the joint by the sides, return it to a neutral position
Down.
after each movement, and assess the great toe of each foot and one finger on each
Down.
hand.
Down.
For the next assessment, check
I'm going to
graphesthesia.
draw a letter or a number in your hand. I'd like you to tell me which one it is.
Okay.
Go ahead and close your eyes.
A literate patient should be able to recognize your letters and numbers easily on both hands.
8.
Good.
A.
Good.
I'm going to draw a shape in your hand.
For a young child, adjust this test slightly.
This is an X.
Instead of numbers or
Close
letters,
your eyes,
use
and I want you to
geometric
tell me if I've
shapes.
drawn two
Draw
different
them
shapes
twice
or
in the
same.
child's hand. Then ask him whether the shapes are the same or different.
Different shapes.
Different shapes? Good. Let me try your other hand.
Mr. Gardner, I'd like to see how well you do certain movements. Pat your
Begin
hands on
by
your knees,
testing
watch
rapid
your hands
rhythmic
between the
alternating
palms and the
movements
backs of
with
your
the
hands.
patient seated.
And a little faster.
The movements should be smooth and
And now as
rhythmic,
fast as you
even as
can.
the speed increases.
Touch your thumb
As an
to each of your
alternative,
fingers.
have the patient touch his thumb to each finger on the same hand, from the index finger to the little
Now a
finger
little
and
faster.
back. There should be no stiff, slow, or
And now as
uncoordinated
fast
movements.
as you can. Very good, Mr.
Next,
Gardner.
test
Now I'd like to
accuracy of
try another
movements,
test. Take
beginning
your
with
right
the
index
finger-to-finger
and touch your
test.
nose. Now touch my finger.
The patient's movements
nose.
should be rapid, smooth, and accurate, with no past pointing. Next,
Good.
perform the finger-to-nose test.
Now for this next test, take your arms out to their sides, close your eyes, and touch your nose with one index finger and then the other.
These movements also should be rapid, smooth, and accurate, even with increasing speed.
Now a little faster. And now as fast as you can. Good.
Would you like to meet Mr. Bear? Can you touch his nose? Good. Let's play a game and see if you can catch Mr. Bear. Good.
To test accuracy of movements in a young child, observe her ability to reach for, grasp, and release a toy.
Great.
You should
good at
see
this
no
game.
tremors or overshooting movements.
Now I'd like to test your leg movements. Take your
Now
right
perform the heel to
right up
shin
your left
test,
shin up
which
to
may
your
be
knee,
done with the
and then
patient
back down
seated,
again.
standing, or supine. The patient should move his heel in a straight line, without deviations to the side.
I'd like you to stand
To
with your
assess
feet
the
together
patient's
and your arms
balance,
at your side.
use equilibrium tests, such as the Romberg test. Slight
Good.
swaying is
Now
expected,
close your eyes.
but stand nearby in case the patient starts to fall. If you see staggering or loss of
Now open
balance,
your eyes.
delay the other balance tests.
I'd like you to stand with your feet shoulder width apart. Keep your eyes open. I'm going to give you a slight push.
Your push should throw the patient slightly off balance, but he should recover his balance
Now
quickly.
close your eyes. Stand on your right foot and keep your arms at your sides.
To continue, have the patient stand on one foot with his eyes closed and arms at his sides.
Now the left.
He should maintain his balance for 5 seconds, although slight swaying is expected.
Now open your eyes. Try hopping on your right.
Also, have the patient hop in place on one foot with his eyes open.
Now try
He
your
should be
left.
able to hop for 5 seconds on each foot without losing his balance.
Now I'd like to see how well you walk.
Now
Please
evaluate
look
the
to far
patient's
wall
gait.
and back.
The gait should have a smooth, regular rhythm and symmetric stride.
Good. Now I'd like you to try the same thing with your eyes closed. I'll tell you when to turn around.
The patient's legs should move easily between the stance and swing phases, and his arms should swing smoothly and symmetrically.
Stop.
Because proprioception decreases with age, an older patient may have short, uncertain steps and a shuffling gait.
We have one more walking test to do.
Okay.
This time, when you walk to the wall, touch your heel to your opposite toe, like this.
To exaggerate
Your
any
eyes open and your
unusual
arms
gait,
at your side.
check heel-toe walking. As the patient walks, you should see consistent contact between the heel and toe, as well as good balance.
Now do the same thing backwards.
The patient may sway slightly, but should not stagger, reel, or fall.
Good, you can stop.